Hello, everyone. I hope you're all keeping safe and healthy by adhering to all social distancing norms to curb the spread of COVID-19 virus. Remember, we're all in this together. So we are back again with our Healthcare Dialogue series, and this time on the hot seat, we have Joyce Nazario. She's the first certified patient experience professional in Asia and has been working in the patient experience field for 10 years. She's currently the head of the Patient Experience Group at St. Luke's Medical Center, the top healthcare institution in the Philippines known for its brand of great patient experience. Thank you, Joyce, for joining us today. And while we look forward to your presentation on patient experience measurement at our upcoming Patient Experience and Engagement Summit next month, we'd like to take this opportunity to have you share some of your thoughts on the changing healthcare dynamics in the light of COVID-19 pandemic. We are now almost more than 6 months into COVID era, and hospitals are still struggling to move the needle on patient experience with many physical isolation measures, PPE requirements, and visitor restrictions in place. While waiting it out is an option, most have realized that there is little chance that healthcare will return to normal anytime soon, if ever. Instead, leaders are facing growing pressures to seek out new normal and find solutions to adapt. So, to set the tone and principle for our discussion going forward, I'd like to ask, according to your opinion, how has this growing pandemic affected patient experience at St. Luke's Medical Center? And what lasting transformations will we see in the coming future?
Okay. Thank you for having me here today. Well, I think the one thing that's definitely been happening at St. Luke's Medical Center and I guess across the different healthcare institutions is the acceleration of digital transformation. Even before the pandemic, St. Luke was already on that path. We're rolling out an EMR very soon. We're in the middle of it. And even for patient experience, the digital transformation has moved much faster than we expected. What we were thinking of rolling out in a year or two in terms of our digital solutions have been moved up very quickly. Surprisingly, it's a bit easier than we expected. Uh, People are transitioning very quickly to the virtual style of talking to patients. But, it is very different because patient experience is very known for its compassion, empathy, being with patients, very high touch. And like one of my staff used to say, that heavy artillery of taking care of patients is taken away from us because obviously we can't do that because of the different infection control protocols that are necessary to keep in place for our patient safety. So what we have to do is have to create high touch, but digitally now. And by rolling out of these different digital solutions, that's the really major change in the way we do patient experience. It's funny how quickly we have transitioned into the virtual setting. I just asked, this time last year, I was in Bangkok doing the talk, and now we're doing this virtually, and it's gone very fast. There's hardly a transition in me being able to do an interview like this. So before it was in the same room, you were together with your patients. You have a family conference, you're in the same room. Now it's transitioned into we use Google Meet, so we use Google Meet for for our family conferences. Um, Documentation is done digitally as well, and yeah, I mean that's really the big change, and that's what has pivoted during the pandemic in the last few months.
Yeah, I agree to that. Necessity is mother of invention. I'm sure all of us would agree to that. And
Hmm.
it is one of the most critical question in the current time is to how to maintain empathy in virtual care. And that's the most haunted question that the caregivers must be facing, or a struggle that the caregivers must be facing in the real time.
Yes.
So because we're talking about virtual care at this point in time, in the light of ongoing digital transformation in the industry, what do you think the digital patient journey would look like beyond COVID-19?
I think well, of course, COVID is not a good thing. It's not positive, but we have to think about of how can we create something positive from something very negative. And one thing that we realized would really help our patients, not just during the time of COVID, but also anytime, it doesn't matter whether there's a pandemic or not, is creating orchestrated patient journeys. So before, when we used to have patients come in, I would say when they step into the door of the hospital, they're a captured market, meaning they've made the effort already to come to the hospital. Of course, they're going to do their procedures with us. Now, when they're outside of the hospital, there's a lot of fear and anxiety of coming into the facility. So what we have to do for our patients now is create these orchestrated journeys, meaning prior to even stepping into the hospital, we have created ways to make sure that everything end to end the patient has to do is already set for them. So once they come into the hospital, they have a document or they have a digital document because it gets emailed to them of what they're going to do step by step. Payments have been made already. The procedures are all scheduled already, and that's one thing that has really changed, a positive change despite I would say a negative time in the healthcare industry.
Yeah, I think it's COVID-19 has its positive and negative side. They're the two sides of the coin that we got to live with. That takes me to the another very interesting question that we have. What is the most interesting thing that you've observed while analyzing patient feedback to measure and improve patient experience?
The feedback has been very vital to us in terms of making rapid iterations for improvements in the hospital. Now, I would say this time is unprecedented in how we create processes in the hospital, administrative and clinical processes in the hospital. So, pandemic, I would say in the Philippines, the height of it really started and the lockdown started in the middle of March. So, we're going into the 6 months right now. It the first 3 months were so vital in collecting the data that that is how we made our quick transitions into the way we created the new normal for the hospital. Measurement should never be forgotten because measurement is the way we hear our patient's voice. The measurement we do is digital. We have a third party doing our measurement, so it's digital. We are very lucky in that sense. We decided to do that pivot a couple of years ago, so there was no problem in getting the surveys from our patients and getting feedback from our patients. But we could see also how in the measurement itself, it changed on what the priorities of the patients were. Before, you wouldn't hear a lot about safety because it was given that when a person comes into the hospital, and especially the way our hospitals are set up in the Philippines, at least St. Luke's Medical Center, that it's a nice hospital. You have a beautiful lobby. There are security guards. The safety was not in question. But now this, patients would put in the comments about what about my safety in terms of not getting COVID, or for example, patients who are very immunocompromised, they would think, you know, I have an extra safety thought when it comes to coming to the hospital and COVID is present in the hospital. So I mean that's why it's so vital to have the measurement because there are things that we do. For example, design thinking is very important in terms of rapid iterations. Design thinking is very much based on data. It's
Hmm.
also very much of observation at the same time. So when we create new processes, say before, I know this happens across a lot of hospitals, the sudden influx in the emergency room. So your triage system is totally different
Yeah.
because when you would have 50 patients in a shift, you would have 150 patients coming now in a shift because all these people are worried about getting COVID or worried about their symptoms if it's COVID. So the design thinking and creating of the new process is really vital because it we were able to create solutions immediately, despite a sudden surge, an unexpected surge, or a black swan event like COVID right now.
COVID-19. Yeah, I agree to the fact that it's the most unprecedented times that we're living in, and certain elements which were taken for granted earlier, as you spoke about safety element, it's now of prime importance to the patients and their families as well as to the caregivers. So, when we're talking about a lot of innovations which are taking up to speed in the current time, as opposed to what it was before COVID, pre-COVID, how do you sustain the healthcare innovation in the current new normal and beyond the COVID era?
Well, innovation is well, before innovation, I think would fall under very specific groups in the hospital. But now, creating multidisciplinary committees, which which specifically concentrate on innovations within the time of COVID and also innovations in the time of post-COVID. That's very important to sustain the innovation because with again a healthcare system is definitely interdependent. It's multidisciplinary, and by having champions from each of your different stakeholders come in and represent and come together to form a committee and make sure that these innovations are properly monitored, they're tracked, they're implemented, and sustained. So for innovations, a task force, a committee, a specific group always managing the innovations that will really help in sustaining.
Great, very well said that. I think it's, as I said, we are all in this together and a multidisciplinary effort towards driving the innovation in the healthcare sector and making sure that it sustains its momentum even beyond COVID era. So that brings me to the last question that I'd like to ask. As a speaker at our upcoming Patient Experience and Engagement Summit, what is that you're most looking forward to from your experience at the event?
The even from last year, the best part about was getting to interact with colleagues, especially those in the same field. Now, I mean, patient experience is an emerging part of healthcare in Southeast Asia right now. So it's always good to connect somehow, even if it's virtually. I'm also a student of the field. I mean, I do like to talk about it, but there's no such thing as a top expert or someone who knows everything about the field, and getting to be a participant also, because when I do talk I'm allowed to participate as a someone watching the different presentations. That's also a really great part, a really great way to find out how the patient experience is right now. It's going to be my first time to get to listen to how other healthcare institutions are going to, or how are they handling the pandemic, but also what they're going to do once things get back to normal. It's also interesting for me to see how it happens in different cultures, because I was telling last year when I was sitting around the table where I was, because I did speak last year. There's a table of 10 people, and 10 people because there's so many different kind of cultures in Southeast Asia. You have a table of 10 people, but you also have 10 cultures, and
True.
it's wonderful. It's wonderful because each and every culture will bring to you something new and something you could maybe even implement in your own healthcare system. That's why it's always so great to join this summit. I learn a lot. I hope to help people also with what I'm able to impart when I do the talk.
Very well said. And I agree that learning has no age and learning is an ongoing process. It's a journey, not a destination. And that's the intent behind me putting up this show every year. So superb. It has been a highly insightful session indeed. And we sincerely appreciate you sparing some time off your busy schedule to join us today. Therefore, I'd like to conclude by saying that to maintain or even re earn the trust of consumers in the current time, healthcare organizations will have to demonstrate competence, reliability, transparency, and most important, a sense of empathy in how they conduct their operations moving forward. It is true to say that it's a sink or a swim market for the region's healthcare organizations. Looking forward to hearing more such stories of hope, encouragement, and resilience from some of the great minds in the healthcare fraternity at our Patient Experience Engagement Summit next month. Thank you very much for joining us.
Thank you very much.